An anal abscess is an infection around the glands of the back passage, the anus in technical terms. It's uncomfortable and it's quite a common condition. The vast majority of time, the anal abscess happens because we get infections in our anal glands, which are inside our bottom. We all have these anal glands. It's got nothing to do with personal hygiene. These glands get blocked and get infected, and then occasionally can give significant pain and discharge. Occasionally, it can be associated with other conditions, occasionally like inflammatory bowel disease, or very, very rarely, cancers can also present this way too. The symptoms from an anal gland infection or an anal abscess are predominantly pain in the bottom, discomfort, difficulty in having the bowels open and going to the toilet, occasionally associated with discharge. One of the tricks or the difficulties is with patients is it's embarrassing. They don't want to talk about it. And occasionally the pain will then disappear as the patient gets a discharge from the bottom going to the toilet. Pus will come out. But unfortunately, that can then recur 2 or 3 weeks later as it becomes a recurring issue. So it's predominantly pain, sometimes bleeding, and difficulty in going to the toilet with some discharge. I think most people say, I hope this goes away on its own so I don't have to see anybody. Completely understandable. I would suggest that the majority do need a surgical intervention to settle them down. Some people will have a discharge and it settles and they're fine, but the majority will need a surgical intervention. One, to make sure there's no other disease, but to drain the infection before it gets worse. Just occasionally, it can be treated with antibiotics, but the antibiotics have to be a special type for the bugs that happen in your lower bowel. So it's always about the assessment of the patient, because often we have to be very careful of that. Some patients who are elderly, overweight, and diabetic, anal abscesses have to be treated very aggressively. And that's a surgical procedure by drainage, initially making sure the patient's comfortable, antibiotics, and booking them for an operation where they have an anesthetic so you can assess the anal canal, assess where the abscess is and drainage, and drain that abscess. In elderly folk, this can be quite a difficult thing to treat, but the predominant treatment is examination of anesthesia once you've assessed the patient appropriately. Absolutely, because it comes from the anal abscess does come from the anal glands. Those anal glands can initially get infections, then get better, but that abnormality is still slightly there, and these abscesses then can recur. And that's about 1 in 10 patients they can occur, and they can develop a condition called an anal fistula. And that fistula is a join between the anal canal and the skin of the buttock, and it can also go through the anal muscles, which is a particularly challenging thing to treat sometimes.